So you must be thinking, what is going on with CRNA life in the hospital setting, especially during the COVID-19 crisis that's going on now? It's a pandemic that's definitely, of course, traveling across the world, affecting certain regions more than others. And what's going on with anesthesia? And what's a day in the life of a CRNA that's experiencing this? Well, I'm going to go all into that, so definitely keep watching. My name is Christine, and welcome to a new video. If it's your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing and hitting the bell so you don't miss anything. So yes, a day in the life of a CRNA versus my words and my wisdom, what I've seen is definitely has been changing. Hours are cut in half, which is it can be significant to some people. And of course, now even if your hours are cut in half, now maybe some of your hours are going to be transformed to go into the ICU. So you may get, the same amount of hours that you were working before, but now since there's not elective cases, as well as there are not, is more emergent or urgent cases, of course, the operating room environment where, of course, we are working in, there's not as many cases. So what's going on? So, of course, things are changing. Now, if you're in an ambulatory care center where you do a lot of elective cases, if you're a traveler, if you're an independent contractor, maybe you're per diem, yeah, you will be more affected than anyone because you're not going to work as many hours as you would as if you were a W-2 or independent contractor that's full-time at a facility. So depends on the place, depending on the region, because of course, depending on the state, depending on the hospital, depending on the facility, that might not be much of a change. But at my facility, what I've been seeing and what I've been hearing from other CRNAs, that is only emergent, urgent cases that need to go. The elective cases are not going to go at this time. And it's just a time period where, the next couple of weeks that things may slowly start transitioning back. But, the reasoning behind this is because we want to save resources, because naturally, with this virus and depending on how many patients are coming into the hospital, they're going to require health care. And if we start utilizing all of our resources, what are we going to do when we need those ventilators? When are we going to need those masks, those gloves, those equipment? So a lot of hospitals are transitioning where they're just keeping it like that. Now, CRNAs, depending on where you're working, they're transitioning and working in the ICU. Because we've got to remember, it's an overwhelming population of patients that are having, COVID virus, depending on the hospital. And there's COVID floors, a lot of airway management, a lot of ventilation management. And so a lot of physicians and nurses are overwhelmed. So CRNAs, got to remind yourself that you are an ICU trained nurse. You have ICU experience, which is amazing that you have that because that's a skill set that will keep you strong, have a strong foundation. So when you are a CRNA, you are really good at your skill set, vet changes, titration medications, as well as pathophysiology, critical care management. So it's kind of good because you kind of can transition into the ICU. So now, not even the ICU, you got to think about the ER. Now, the ER is also having a lot of patients coming in as well. So the ER as well as the ICU, and of course, there are some specific floors that have specifically for COVID patients. CRNAs, depending on where they're working, are being a part of that team. They are doing intubations, they are doing extubations, weaning protocols, they are helping with hemodynamic monitoring, they are placing arterial lines, placing extra IVs, and there's so much more. So you're kind of assisting like an intensivist, helping the team because, they're focused on so much more. There's some patients that are going to be in prone position because their lungs are they're just becoming like something called acute respiratory distress syndrome, where in order for them to do better, they need to be on these specific bed protocols, as well as maybe they may be on ECMO. So I don't know for sure if there's many patients that are to that extent, but there are a lot of patients who are COVID positive. No matter the age, no matter the the comorbidities, it can happen to you or me, and you can end up being short of breath, having that cough and fever, and then ended up within hours being intubated and being on a ventilator. So I've definitely heard from my friends who are CRNAs are in New York. They see patients from all different spectrums. And, it's not just affecting, this specific population or this specific comorbidity. It's affecting, of course, if you're elderly and you have comorbidities, you're more at risk to becoming more critically ill. And, of course, your immune system is lower. So you're just at risk. but you could be, you or me, can be affected by this virus. So, it's something that we have to be aware of and just be mindful of how important it is for us to be aware of our surroundings, social distancing, as well as hand hygiene, hand washing for more than 20 to 30 seconds, using hand sanitizers, wearing masks depending on the facility. With CRNA, so saying, for example, I'm doing a patient that's COVID positive, or maybe person's, for example, there are some patients who are asymptomatic that you're taking care of, and you never know that they're COVID positive. And maybe a week or two from now, they start having symptoms, and then now you were exposed to that patient. So what do you do to protect yourself? So at my facility, and as well as other facilities, these are recommendations, but the AANA, as well as the CDC, as well as the president, has been recommending that, when you're walking, in public, they recommend you wearing masks. I mean, of course, it's your choice. It's not forced upon you. But if you want to be extra safe, of course, wearing a mask to protect yourself. Depending what type of mask you want to do, it all depends on you. There's so many different, YouTube videos. That definitely check out those. I go into how to make masks, how to make filtered masks, But definitely I feel it's important if you do have boxes of masks that are healthcare, like sterile or in boxes that hasn't been opened, I definitely recommend you donating it to the hospital. And as well as if you are a person that's not working, definitely make a handmade one. There's so many videos that can help you learn how to do that. Because definitely being in a hospital setting, you're definitely seeing supplies decrease over time. And gotta remember these nurses, these doctors, especially even auxiliary staff, are putting themselves in the front line to save lives. And I feel that's powerful. And I think that's amazing that, we're trying to make a difference. And I think it's awesome a thing to do. So you got to remind yourself that, people are putting themselves at risk, and they need to have appropriate, equipment to make sure they're safe as well. And they don't bring it to their family, of course. So at my facility, starting this past week, so now I'm doing this video April 8, 2020. And so we have to basically, we come into the hospital, we walk into the hospital. Before we even walk in the mornings, we get tested with our temperature. They do a laser temperature test, as well as they ask us questions. Have you been out of state? Have you been out of the country? Are you having any specific symptoms? And then we are passed a pamphlet that goes through the hospital policy protocol for this specific facility on what we're doing in regards to keeping our staff, our patients, our families safe. So we wear a mask, and you have to wear, as soon as you enter the hospital, you wear that mask the whole entire day. So that's just our policy at our hospital. So you keep yourself safe, and you keep, other people safe, of course. And so if you were to eat or drink, of course, you take the mask off, but you're always wearing a mask. And then when you leave, you take that mask and you throw it out. So everyone wears a mask at my facility, and every single day, this is what happens. Of course, there's machines around for hand hygiene, for, using hand sanitizers is very important to keep your hands clean. And if you can't use hand sanitizers, do it the old-fashioned way, soap and water, and wash your hands for 20 to 30 seconds really well. That is safe. And of course, now for us with anesthesia, we are using, depending on the facility, there's this glass type of box. It has holes on the sides, holes in the front, and basically you can use a video scope depending on the facility, and you basically have goggles to protect yourself, because of course, naturally we have hands, we touch our face, we touch our eyes. So I feel wearing a mask protects you don't start touching your face, because you're aware of there's a mask on your face. But you gotta remember your eyes, you're touching your eyes, and of course you're touching your hair. So we wear, of course, naturally in the operating room, we wear a hat anyway. So I'm always wearing a hat all the time. When I do procedures, I have to wear a hat. But also when you're doing it, for example, an intubation, extubation, if you're in an aerosol type of case, like an EGD, for example, or a bronchoscopy procedure, as well as if you're deep suctioning a patient, or if you feel like, and this is any patient, we're just using something called an N95 mask, which is more protective of us from certain viruses, okay? So we use that. And then if it's a basic procedure, you're not putting yourself in an airway, you wear a basic mask. And now you may be thinking, what if a patient's COVID positive? Now there's a whole different protocol that's used in the ICU, gowns and masks, and of course N95. a lot of hand hygiene, and of course with the intubation and extubations, just a specific type of contraption we're using to intubate our patients, so we're safe, they're safe, and the environment is safe. And of course the solutions we're using, there's actually a big shortage in the solutions we use to clean our environment. So now we have to spray things on a certain type of paper, and we'll have to make sure we sterilize and wipe everything down. And what I've been seeing in our hospital facility, that are using this UV light technology. So after, even if it's any case, they put this UV light into the room. Of course, they clean the room like they usually do, like deep cleaning, and then they use this type of UV light technology to help clean the environment, clean the air, which is pretty amazing. And so we're just doing the standard. So it's great that, my facility has this plan in place, because, we're seeing in New York that it's growing and people are getting sick, and it's being passed along. So we're actually, in my facility, we're taking more of aggressive approach. We're wearing masks all the time. Now, a lot of people are like, oh, I gotta wear a mask all the time. I feel like I'm suffocating. I know we have our opinions, and that's totally fine. But for me, I'm fine with it. If I'm protected and I'm just doing something that's what is going to make things better, I'm going to go ahead and do it, and I'm being supplied with these masks to use all day. I'm fine with it, I'm very thankful to have this opportunity to even have a mask, because you got to remember, places in New York, depending on the facility you're working at, they don't even have masks. People are wearing scarves, and how much protection of that is, I don't know, but it's better than wearing nothing. So I'm very thankful and very happy that I have this opportunity to even have masks to wear every single day, as well as, of course, when you even have opportunities for masks. But I've been noticing that, of course, naturally, the great thing is we have been coming together as a country, as well as a state, as well as a hospital, and a lot of people doing a lot of donations. And of course, ventilators are being, moved around between facilities, because now, of course, you may think to yourself, a facility may have 20 ventilators. Now you may need to have more than that to be able to equip yourself to have a safe environment, to make sure can take care of these patients well. So yes, the day in the life of a CRNA in the COVID virus is definitely different. The hours might be different. And of course, we might be working in the ICU environment as well as the ER environment to help with patients. But I'm happy I went to the healthcare field to not be afraid. I went to the healthcare field to save lives and to help people. And if I have to do it every day, until the day I die, I will, because this is what I chose to do. And of course, you might be scared. I get nervous sometimes and I get scared, It's absolutely normal. But just remind yourself, if you are in high school, if you're in nursing, or maybe you're in nursing school, or maybe even you're a CRNA just like me, just remind yourself why you went into nursing. Got to think about Florence Nightingale. She started, think about her, think about her practices of what she was in certain environments, a lot of risk, learning how to take care of patients, sanitation, as well as hand hygiene and more. So, and she started it all. And, so you got to remind yourself where we've come from and why we're going into nursing in general. So I hope this helped you, and if you have more questions about it, definitely put it in the comment below, and definitely subscribe and click the like button. So if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of these videos over here, and I'll see you in the next video. Thanks for watching.